Good evening, I'm Sanka Price, along with Stetson Babb of Starcom Network, and together we will be your hosts this evening for this special COVID-19 alert. Stetson?
Well, this program is being brought to you jointly across our common radio, TV, and social media platforms to reach the widest cross section of the public, to sensitize you about the seriousness of this COVID 19 threat, especially during this long weekend when, let's put it this way, the COVID protocols might be challenged.
Stetson and I will be discussing the COVID-19 variants and how they can impact Barbados with epidemiologist and president of the Barbados Association of Medical Practitioners, Dr. Linda Williams, senior lecturer in epidemiology at the George Allen Chronic Disease Research Center, Dr. Natasha Sobers, and senior economic advisor to government, Dr. Kevin Greenidge. Just a bit of housekeeping. Newsnight will start at 8 o'clock, so this is a 1-hour program. Stetson, over to you for the first question.
Well, thank you, Sanka. Good evening, ladies and gentlemen. There's a perception that Barbados has, individually and collectively, we've patted ourselves on the back about our handling of the COVID-19 pandemic. BAM, to its credit, has had some concerns from the very start. This question is to BAM. Where do you think we stand in Barbados right now?
Um, Thank you, Grant, and this opportunity to be able to speak to the public about where we are in the pandemic at this present point in time. As you quite rightly said from the beginning, BAP has voiced our concerns about the pandemic, and we think we've done a fairly reasonably good job as a country compared to many other countries worldwide. However, I think at this point in time, everyone will notice that a change is occurring, and that change involves a change in the pandemic itself all over the world. There are new variants, and some of these variants are more transmissible, and therefore they are causing what we call now a pandemic within a pandemic. And so we are seeing a pandemic among the fully vaccinated people, the unvaccinated people all over the world. And so this is presenting a new challenge, and this new challenge is what is leading to, you know, a re-evaluation of our current place and position. As it stands as a country, we have just about 27.6 is the latest amount of the percentage of the population that is vaccinated. So there's still a large amount of our population that is unvaccinated, and therefore we're not protected really as a country against this virus. We have to be very cautious. There's a lot that we have learned from other countries. There's a lot that we have learned from our experience, and so it's time to not let go of the reins and feel that all is better because we are watching what other countries are doing in the world. We are not there yet, and we should not act as if everything is back to normal here.
There is a big gap in our strategy, well, because of the unavailability of vaccines, the low rate of vaccination. Therefore, what needs to be, given that reality, what needs to be the key strategy and our strategies in our response right now?
So we have two methods of protection against the COVID-19. Our immune systems have no experience with this SARS-CoV-2 virus. So if you're unvaccinated, you are vulnerable. And now there's a change with the Delta variant, which I think we're here to talk about a little bit more.
If we can just delve into the whole thing of this Delta variant and the other variants, and you made the point that a change is occurring. So how does that really impact us here in Barbados? What are you seeing? What is the medical fraternity seeing?
Do you want to take this, Dr. Sobers, or should I continue? Okay. Sorry.
We do have, thank you very much, a number of variants of concern um, that we are looking at around the world. And we know, the Ministry of Health told us that we predominantly have the alpha variant here circulating, but we have seen one or two cases imported of the delta. The thing is that we have watched what has happened in the United Kingdom, we've watched what has happened in the US, we've watched what has happened in India and other places, and in all those places, slowly the Delta variant became the predominant variant. And while that is not the case now, it is not the predominant variant in Barbados now, we have to look at the experience of other countries and ensure that we protect ourselves and we prepare ourselves should that variant come to our shores. And the best ways to prepare ourselves and to prevent it from spreading and truly causing havoc on our shores would be the tools that we have in our arsenal that Dr. Williams has spoken about. So we have to continue with our social distancing. We have to continue with our masking. We must continue with our personal hygiene measures, and we should get vaccinated. We did mention that we don't have a great amount of the vaccine, but we have some. And we should be using it. So we've seen the Delta variant in other places, and we know from the high transmissibility of this Delta variant and the new reports now that are suggesting it may be more severe, that we do not want this to become the predominant variant here. And prevention, just as we say for an individual, is better than cure. So the best things that we can do to prevent it from spreading, we have to continue to do those things. And we understand that there's COVID fatigue. I'm fatigued. But we have to continue with the things that we have been doing so well. We've really been doing well as Bajans, especially compared to other places. And we have to continue to do those things.
But Dr. Sobers, we had 14 cases yesterday, one case the day before, 11 cases today, but they're going to be reported. We're doing well. This is a long weekend. This is crop over weekend. Why should I, as John Public, not go and have a good time? I mean, after all, it's crop over.
I know. I really want to have a good time as well. But I I have the unfortunate position of predicting and doing models to say, what if just 10 people, so we had 11 cases and 14 cases, what if just 11 people decided, I'm going to go to an event and I'm going to have a good time no matter what, it's just one weekend, one super spreader event, because those 11 people then go spread it at that event with 100 others, and they go back to their family, and there's exponential spread. And those numbers will rise so quickly, it will be unbelievable. So it's hard for us to understand and predict and see those things, but just the 11 that we're going to be reporting today, if those 11 cases get into a super spreader event and spread to, I say 100 because I'm being conservative, because I like to be conservative, but let's say they go to an event with 200 people, that spread alone will take us back into what none of us want. None of us want lockdown. I'm pretty sure, because I'm tired of COVID and lockdowns. None of us want lockdown. So really, we are walking slowly, because right now we can't run. We can't go to the grand events that we would like to go to. So we have to walk slowly and carefully, so that to make sure that we don't stop completely. So we have to walk slowly so we don't stop.
So we put the whole question of the battle against the pandemic and the vaccination drive into maybe a broader context. Because as you well know, vaccination, there's a great deal of vaccine hesitancy in Barbados among the population. And anyone who listens even casually to the call-in programs and monitors the social media platforms will get a sense of how the people feel. When we look around the world, there are, I think, almost 200 million deaths from COVID-19, more than almost 200 million cases, rather, more than 4 million deaths. And there continue to be surges, even in the countries that have had some of the highest rates of vaccination. We currently have surges in India, I believe India and China have the highest rates of vaccination. Yet they have been battling surges. So I want you to speak to the people, put in context, beyond vaccination, how effective is vaccination? And from a holistic level, how does this battle need to be fought? And therefore, what do we in Barbados need to be mindful of, and what do we need to do?
Yeah.
Okay, I'm gonna speak. Go ahead.
Go ahead. No, go ahead. Go ahead.
No, what I was gonna say is vaccination. You have to understand it in context of what it is and what it's doing. The vaccination is protecting you, but is also protecting the entire population. So vaccination, as we said, is a tool to protect yourself from hospitalization and from the severe outcomes of COVID. But it's also protecting the population, because if you get COVID-19, even if you had a breakthrough infection, okay, then that disease in you would be quite mild in most cases, right? So vaccination protects you from the severe outcomes. And why is that important? Because the thing with COVID is not so much that the number of deaths. I know people kind of monitor and say, well, we only had 48 deaths from COVID. But the thing with COVID is the overrun of the medical system. And that's something we've been speaking to over and over again, because we know as doctors the fragility of our health system. And we know that if we have a situation where there is a need for medical services for many people with COVID-19, it means that can be offered in the same way to persons who do not have COVID-19. So in other words, if you had appendicitis, or if you had an infected diabetic foot, or if you had some other minor thing that would not normally lead to your death, okay, it could become major. Or even if you had something major, like a heart attack or stroke, if the resources, if the ICU facilities, those who manage them, and the human resource is taken away by having to deal with an influx of patients who are suffering from respiratory failure, etc., from COVID-19, will not be available to you. And this is an important point, because excess death that we would not normally expect because the resources have gone elsewhere. Now, you mentioned, Stetson, that India has a high rate of vaccination. Indeed, it does not. Okay? And that was one of the reasons why they continue to have mass gatherings, because at first the uptake was poor, and they continued to have mass gatherings, and then they had a sudden outbreak of Delta variant. The uptake and vaccination has increased now, but at the time when they had the outbreak of Delta variant in December of 2020 and ongoing, they did not have a high rate of vaccination. But even in countries,
I believe what I said though was that they have the highest rate of vaccination, India and China.
They don't. They don't. And that's what I'm trying to tell you. They don't. They don't have the highest rates of vaccination. And at the time when they had the outbreak of Delta variant, they certainly did not. And that is something to bear in mind. They had a higher uptake since the Delta variant broke out. Then the population went to go and get it. But at the time, they did not have a high uptake. But yet they continue to have mass gatherings, very large ones in some cases. And those led to rapid spread of the Delta variant. So, people are wondering many times, well, why bother to get vaccinated if you can still get COVID? You can get COVID, but the outcomes will be a lot better. And it's not everyone. There's a much lower in vaccinated as compared to the unvaccinated, and the outcomes are quite different for people who are vaccinated compared to those who are not. So even in the countries like the USA and UK, who have much higher rates of vaccination, although there are breakthrough infections, and some breakthrough is expected with any vaccine, particularly in those who have immune compromise, like the elderly, and for those who are on immune suppressant drugs, etc. Those people, we expect that there will be some breakthrough infection. Also, people who had the vaccine very early, they may start to have some waning effect of the vaccine. So that's why there's talk now about booster doses. But we expect some breakthrough, even in those countries. But even when there is breakthrough, the outcomes are very different among the vaccinated compared to the unvaccinated. And so vaccine and protect the health system from being overrun. And that's something I want people to understand. If our health system is overrun, then we can't take care of we can't take care of simple sources of infection or disease that might not otherwise have led to death.
I want to stand corrected. I think I should have referred. Thank you. Before you go on, I think I should have referred to not necessarily rates, but highest number of people because of the scale of the number of the size of the population, the number of people actually vaccinated. But thank you. Go ahead.
Yeah, it's not the proportion. Yeah.
Not correct. So correct.
If I may bring in Dr. Greenidge here, for the last few days, the numbers in the supermarkets and stores suggest there's been an uptake of economic activity, which is a good thing. But having listened to the doctors right now about, the medical doctors right now about these variants and the possibility that they could affect the population if there's a lot of circulation. Can you give us your take on how this this threat is really impacting us and could possibly impact us if this weekend we go overboard?
Thank you. So back in 2020, when this COVID first outbreak occurred, and it occurred in the third week of March 2020, then we went into shutdown. And we all know the outcome. In 2020, economy collapsed by almost 18%, and about $2 billion in economic activity was lost because of COVID. Our main economic activity, tourism, fell 90% in the comparable period year between that and 2019. We have always said that we expect, because of a number of factors, we open up the global markets, our source markets, increased seating capacity, etc., great economic activity, that we should see a pickup in tourism, and by extension, a recovery, partial recovery economic activity for 2021. But we also condition that on us having being able to get our COVID situation under control and avoid a lockdown. Indeed, in February this year, we had a lockdown because of the resurgence of COVID cases, I believe, near the end of the year, end of 2020. And that, for all intents and purposes, have slowed what we would expect to happen in terms of our recovery for the first half of the year. Nonetheless, when you listen to the governor's press release, you will hear that we would have performed in this first half of 2021 better than we did in the first half of 2020. Now, we are still expecting a recovery in tourism for the rest of this year, but this, I've said it before, we've all said it, all the economic team, if we don't get our COVID situation under control, in other words, if we let things go and we have another lockdown, I'm sure that will push our recovery further away. And we've been hard hit in 2020, devastated would be the term to use. Then we had the lockdown at the beginning of this year. Then we had ashfall. Then we had Elsa. If we don't get our act together and we have another lockdown, Well, as we were saying, Barbados, crap was smoke we play. All gone to hell in a basket. So this is why it's important that we each be careful and that we continue to manage this in a way. There are many factors in our favor. We are on the UK grey list. We expect increased seating capacity with the flights coming. We have a lot of government activities beginning. We have the opening of the rest of the world. There are many things in our favor. This one, controlling COVID, is what we have to manage on our end in order to get that over. So the risk is very high.
All right, thank you, Dr. Greenwich. I got the sense that Dr. Sobers, you wanted to make a point before I called on Dr. Greenwich. Could you just make that point before we move on?
Oh, sure. Thank you. Thank you very much. Actually, I wanted to speak a little bit to the vaccine hesitancy that Mr. Bob pointed out that's happening a lot on the radio. Because I remember when I first heard about the vaccine, certainly in December, that the US was giving it, I had some vaccine hesitancy myself. I said, vaccines, I'm not so sure. Maybe I'll let the US do what they're doing and then see what happens. So, that initial uncertainty, what is happening here, that was definitely there with me personally. And I can say that for me, it was deciding to read what is out there from credible literature, from credible sources. I was getting a lot of WhatsApp videos, and fortunately for me, I could tell the ones that weren't very good because they would mix in the truth with the lies. So I would discard as soon as I hear a lie, even though I heard some truth, I would discard it because it had a lie in it. So, I try to go to the credible sources and look at the frequently asked questions, and then also looked at the studies. And one thing I would say for those who haven't gotten their vaccine yet is that, because I got mine then in February, after I read the literature, I was convinced. I was pretty convinced I did not want to be in the control arm because, yes, you could talk about an experiment, but it's people who get the vaccine and those who don't. And those who don't get the vaccine are 25 times more likely to be hospitalized and 25 times more likely to die. So for me, the evidence was there saying, yes, I have this hesitancy, but the evidence is very pressing towards getting this vaccine.
All right. We'll take a break and then we'll come right back. Welcome back. We're discussing the COVID-19 variants and how they can impact Barbados and all of us. And the point just now that was made by Dr. Greenidge is that we're expecting increased airlift and more visitors. And while that is good news economically, does that increase the risk that you doctors are concerned about in terms of how people are interacting and behaving and spreading the virus that could eventually cause another lockdown? Dr. Williams
Yes,
or Dr. Sobers?
certainly. So obviously more airlift is good. We want the economic, but at the same time, we recognize that even as you look at the USA, you look at the UK, you look at what's happening there are more and more people who are contracting the Delta variant. CBC said a few days ago that the Delta variant is at least as transmissible as chickenpox. And chickenpox is one of the most infectious viruses that we know about. Okay, it has what we call a R naught of about 10 to 12. So that means that one person, this is roughly speaking, because there are a lot of factors to consider in that the SARS-CoV-2 virus doesn't necessarily spread in a linear manner. But if we were just to assume linearity, one person spreading to another, um, then it would mean that one person had the potential to infect as many as 10 people. So that's why Dr. Sobers was making the point about the super spreader event. So not only more airlift, bringing more people potentially who have Delta variant, but also we have a new phenomenon that we're looking at, and that is that the vaccinated can also carry what we call a high viral load, a high amount of the virus in their nasopharyngeal or their nasal passages, right? And therefore, they may be asymptomatic, they have no symptoms, they have no breakthrough infection, but because of virus, they may then spread it within our population, which has a high number of unvaccinated people. What the role of the vaccinated people is in spreading the virus is as yet unclear. What we do know is that people with Delta variant, whether they're vaccinated, may be able to carry that virus and spread it to the unvaccinated population. So that's why you would have seen, although CDC had said a few weeks ago, and that's the Center for Disease Control in the USA, move all masks, now they've gone back to saying that masks must be worn indoors. And the reason they have changed that position is because of this recognition that this virus could possibly be spread even with fully vaccinated people. So that is the safe position that they're taking. So while we welcome more tourists, we do recognize that it adds more risk to us as well. And so we must continue mandatory mask wearing in Barbados. And, you know, everyone says, well, I'm just going to do this, I'm just going to do that. But each person individually has a responsibility so that collectively we can protect ourselves. So we need to do that, and we need to also get our vaccine rates up so that even as we welcome more tourists, we can protect ourselves.
Dr. Greenidge has highlighted the economic imperatives, and Dr. Williams, you've spoken to the health realities. How do we balance that equation? That the need, of course, to keep the economy, the engine of the economy running, to restart tourism, but against the very real risks that are posed, especially as we have more tourists coming to the country from countries where there have been surges and where the variants have been rampant. How do we balance that? And what are your concerns and your suggestions?
Well, of course, that's the whole effect of the government. You know, they have to find that balance between health and wealth. We have to find that balance where we don't compromise ourselves economically, but at the same time, we don't take a risk that will cause our entire population to then go into lockdown. And I want to applaud publicly the work of the Ministry of Health and Wellness. They work even when we are asleep, and they work around the clock, and they work very that balance. And so we have to all be responsible, but the government has to balance those things, and it's difficult. It's difficult for all governments everywhere to find that balance between health and wealth. But what we must advocate for as medical professionals, what BAM advocates for, is for health, because we have to put the health realities out there. We have to put the scientific evidence out there. We know that if we have this variant and it runs away, you know, even within a 14-day period, then we could get a serious spread of a dangerous variant. Dr. Sobers would have shown some models, right, that she would have revealed even to cabinet. Then she would have shown some models that show that, you know, if you don't get on top of it, if you don't change your protocols, if you don't make any major changes, if we know that the Delta variant is here at a 2-week period. So it's really important to know what the dominant variant is, and that's why we have been repeatedly calling for that community surveillance as well of the variant, and to take up what offers are on the table so that we can know what the dominant variant is, what you will do, and the way that you will strike that balance changes if you see that the Delta variant is is in fact increasing in your population.
Just one follow-up. You mentioned the protocols. What do you? Sorry, ma'am. You go ahead, please.
Well, I just wanted to actually add one thing that may be a little bit unpopular in terms of how we can help manage. And I mentioned that I had vaccine hesitancy, and I'm now actually going the other direction to say that um, seeing the models and what Delta variant can do, I am actually thinking should should mandatory vaccines be in our arsenal, especially for frontline and healthcare workers? Is that one of the things that we need? Because we really need to have that conversation. I know that people are, upset about it and so on, but we have to have that town hall, that open discussion to say, is this something that is now necessary? Just like how we, as healthcare professionals, vaccinate ourselves against hepatitis B and all the other vaccines. Is this something that we need in order to continue our economic activity? Because it is not just about thinking about health because as opposed to economic. It really is that if we are not thinking about the economy, our health will suffer in other ways. So, I really think we have to put that out there, mandatory vaccines as one of the things in our arsenal, especially maybe for frontline workers and healthcare workers. And it's not a popular idea, but it's an idea that we need to entertain.
Are you
Dr.
saying that
Greenidge,
you?
sorry, let's let Dr. Greenidge come in there because I know he would want to also talk about the striking that balance as well. How can we do that?
Yes, I think it's, and I agree with the doctors. It's important to strike that balance. But moreover, I would like to stress that, of course, on one hand, you have the economic um, benefit we get from tourism that we very much need to get this economy growing. 70%, 40% of our activities economic is driven by tourism. 40% of our labor force is driven by tourism. Almost 50 or half of our foreign reserves come from tourism. So we got to get that going. Yet we got to strike the balance with the public health and make sure that everyone keeps safe. How do we strike that balance? I think it's not only government, it is the responsibility of each and every one of us to adhere to the protocols, wear our masks. If each of us do what we need to do as if we were protecting not us alone, but the people around us, we wear our masks, we adhere to protocols, while at the same time, government through the Ministry of Health and Wellness continue to roll out the latest protocols. And I must stress here, no government in the world, this is an area where we are all learning as we go forward, and we roll out the protocols. We don't want to go too far east, because too far east is west. At the same time, government that will do it best, should be doing its best to roll the protocols, while so the responsibility I want to stress is not just government, it's every citizen, every resident of Barbados doing its part. And if we do that, it may mean in the short term, we have to be a bit more guarded. We have to forego some of the other things that we may want to do and protect ourselves. but we are doing that for a longer term gain, where as the economy recover and disposable incomes increase, and we have this in our control, we can do what we want to do even at that time. So I just want to stress, my point is that balance has to be struck. That responsibility of that balance is not just simplicity of a simplicity of a government responsibility. It is every one of us having responsibility. Everyone, from the guy cutting the coconuts to the person working in the office to the advisors, everybody wear a mask, adhere to the protocol, and that is how we're going to strike that balance. We don't have to wait to know whether Delta is here, is increasing, or my view is do what we have to do now, even over this weekend. If we have to engage, we are masses. If we have to go, we are masses. Look at the protocols, or here the gathering, keep this physical distancing going. Each one of us have to do their part. It's up, it's these simple little things that add up one by one that makes the difference. We don't have to wait for the big announcements and think. We start with simple. The responsibility is everyone responsible, not just government. That's my point.
Can I add something here, Spencer?
Yes. Go ahead, Dr. Williams.
So I understand that quite a few Barbadians are traveling, and I know this is the normal time of year when we would take our trips, when we would go overseas. I understand that people are going shopping. Maybe you're going to a place where people are maskless, so you take off yours too, and you say, well, I'm vaccinated, so I don't have to, and I'm in USA. But I want everyone to think of not only yourself, but the economy. If you think of Barbados as your home and your economy as being important to you, then there are a couple things I want you to think of. You can bring back a variant from overseas. You can bring back something that could then be spread within the population. So when you go, when you travel, you shouldn't take unnecessary risks. You shouldn't travel unless you have to. I want to go too, desperately. You understand? I want to travel, tourists, etc. But I recognize that I have the whole strain as far as possible, not just for myself, but also for Barbados, right? And so therefore we have to, I know it's fatiguing, it's been a long time, but right now we are seeing a change in the pandemic, an uptick in even those countries that we normally travel to. And so don't take risks over there and then bring back risks to Barbadians here.
But if I could follow up, I meant to follow up your point earlier, which is an important point. And you spoke about your concerns about the variants and your advice to the administration. What do you see in the community over there that worries you most? One. Two, you spoke about possibly should we change the protocols based on the threat. What do you see that worries you most, and what perhaps should we change now?
The thing that worries me most is congregating. SARS-CoV-2 virus loves a crowd. I pass places and I see people congregating freely. It's the congregation. Oh, it's just a few of us. It may be just 20 of us that are gathering. This would normally be our line. We all know each other. Or it may be a family thing, where you say, well, we all know each other, or, maybe we're all vaccinated, etc. I see congregating as being our biggest threat. I see people sitting freely at tables who may not be from the same household, congregating. And that's the thing that bothers me the most. I recognize the need. We are social animals. We are social beings. We love to be among others. But I think 10 times, even for myself. If I go into a place, go into a business and I see a large number of people, I turn back and I go another day. Or I find a way to order online. Or I do something else that will reduce the risk of my being in a crowd and not being able to socially distance from others. So that's the thing I think, and of course congregating without mask wearing. The other thing that troubles me, as we mentioned before, is vaccine hesitancy. I understand it. As Dr. Sola said, I do understand it. we all had our own hesitancy at first. But if you look at the weight of the evidence in terms of your outcome, and you get your information from sources that are credible instead of listening to, various so-called experts that are everywhere on the internet, then, you overcome that hesitancy with knowledge. So those two things, I think, are the ones that worry me the most: the congregating and the hesitancy, and the lack of testing. Lack of testing will also be our downfall. If we don't increase our community surveillance, we will always be running behind the eight ball. So I've told everybody, don't just look at this number today. Oh, it was 40 yesterday. Oh, I'm so worried. Oh, it was 1 today. Oh, I'm not worried anymore. Don't do that, because it's the cumulative number that really matters. The numbers, as the curve increases over the days and weeks, that's what really matters. Seeing which direction those cumulative numbers are going in. And I think, I want people to build days of 0 or 3 days of low numbers in a row that matter. So those are the things that I would like to re-emphasize.
Just as a follow-up, Dr. Williams, this weekend, it's a lovely weekend to go to the beach, to have a good time basically with friends that you haven't seen in a while. What are you suggesting? That we should not be going to the beach in droves? That we should not have any picnics? That we should be wary of gathering at the shop and liming with the boys? What are you suggesting? Just break it down for us.
Right at this moment in time, we need further evidence to see whether or not we have the variants, whether it is Delta or Gamma, spreading in our community. We don't have that evidence. So my best suggestion is that we act as if we did, okay? And therefore, I'm going to go to the beach, but I'm not going to go in a crowd. I'm going to see some people I haven't seen, but because they don't live in my household, we are going to do that in an outdoors place and at social distance. So I am not going to be, oh, I haven't seen my friends, I'm going to take off my mask, hug them up, let's all go to the beach together, let's come inside in the shop and have a line. No, it's an individual responsibility and a collective responsibility. And each of us must have that collective sense of responsibility as well. That's what has gotten Barbados this far. I am convinced that the reason why we have not seen what we've seen in other countries is because Barbadians so far have really been fantastic at adhering. But if we let go now, if we run away now and do things, as if we didn't care anymore, and we just, want to just toss everything and forget about it all, the virus is still here. It's still among us, and it tends to pop up very suddenly. So individual responsibility and collective responsibility.
Are you saying that
If I may,
happening? Are you saying
just
they are Barbadians dropping the? Are you saying sorry, my apologies. Are you seeing that happen? Is that your real concern, that you see Barbadians becoming too lax, dropping their guard?
Yes, I think Barbadians have dropped their guard. I think all of us have dropped our guard. I know for sure some of the things that we did at the very beginning that, we don't adhere to them as well as we did anymore. So for certain, yes, Barbadians have been dropping the guard. And I think even within we have started to feel more relaxed, because you know what? We're seeing on TV, we're watching people at football, we're seeing people, doing what looks like normal life. But really, okay, and we live in a country that has basically 70% unvaccinated population. So we cannot get on as if we are the 51st state, or if we are some part of Europe or UK. We live, and we have to continue to keep our guard up.
Dr. Sobers, I think, was making a point. You want to make that point before I ask another question?
yes, I would keep the point. Yes, when I go to the gatherings, I agree with Dr. Williams that I only do with small amounts of people and keep my mask on. And then I go one step further and I've actually asked people, are you vaccinated? Are you vaccinated? And even with those people who are vaccinated, I still keep my mask on. So I tend to keep my, circles a little bit small when gathering. And that was, pre knowing about parties. And just to say too that I think that one thing that's really concerning me, why pages might, just be letting their guard down a little bit is the COVID fatigue. So the advice there would be, let's just also make sure that we take care of our mental health. And yes, we can go to the beach, in pairs, walk early in the morning, and just, relax, take care of ourselves still. So still absolutely having fun, but in small groups and very, keep that bubble very, very, very tight because COVID-19 fatigue is real, and the mental health effects of not socializing in the way that we're accustomed to, those things are real as well.
So how do you deal with children? Because kids just like to play, and they like to play with other children. How do you deal with that?
Yeah, in a similar way. So, I mean, in the schools, they've been now getting accustomed to sort of their bubbles, and it's interesting because we're seeing, we saw seen a lot of the spread in workplaces, but the children have probably been doing a little bit better than we have in terms of sticking to their bubbles. But yes, they like to play, but they're also the ones who, when you explain behavior change to them, they're far more likely to take it up than adults. That's why we target children for things like obesity and dietary habits because they soak up this stuff in a way that adults don't. So just talk to them in a way that they understand. And I have one 10-year-old. He will say, "Okay, don't come near me. It's COVID." And he wants the hugs and so on, but he's understanding that there's that need to social distance as well.
We have
I
10
just
more.
want to reinforce that. Yes, kids can often lead us to do this.
Okay. We have 10 more minutes to go, so we've got to wind it up because we have the news at 8 o'clock. And Stetson, you have a question. Go right ahead.
Yeah, because the reality is, I don't have to remind everyone, this would have been the proper weekend. We'll call it names effects and number effects would be tonight. We'd have had, Kuduma would have been Monday, etc. Our second year without crop over, and that's painful for me and a lot of people. Um, as we stand now, we're not sure, no one can predict what will happen next year. And based on the trends we're seeing overseas, the constant surges and setbacks, including here, is COVID something we may have to learn to live with and make a permanent adjustment? Dr. Greenwich, Dr. Sobers, Dr. Williams, and what are the adjustments we need to make?
I don't know
Oh,
what
so
order you
I
want.
guess I could, yeah. All right. So I
Go
guess I
ahead.
could go first then.
Living with
Just to
COVID,
say,
it's just something we have to learn to live with the reality of COVID. And maybe with us for
yeah,
quite, for the,
yeah, I think for sure it seems as if COVID is going to be with us for quite some time. We had anticipated, even from last year, that we would be dealing with the effects of COVID and the reality of COVID for at least 2 years. And now, with these changes in variants and so on, uh, maybe it's a little bit longer, but we don't know the future. But I think that we have to deal with, let's go back to the old time. It's one day at a time and still taking off chunks. So we're doing what we can. No, right now we know that masking works, social distancing works, and vaccination works, and also and dealing with our personal hygiene. So washing hands and so on. So we're doing the best that we can at this point in time. We can't. I don't think you to certainly have the lockdowns and so on as we were having before. So it's a matter of learning how to manage that. And the best way that we think most societies can manage that right now, today, is by getting herd immunity up by vaccinating. By vaccinating. It is the most effective of all the things in the arsenal, and it's our best bet at this point in time. And even as we vaccinate, we are vaccinating with masking and social distancing because those things are also important. So we can't take anything off the table as well. So unfortunately, this is going to be with us for quite some time. And even after COVID has, resolved, there are some things that are going to be residual from COVID that we will have to now combat as a result of COVID. Those mental health issues that I spoke to, some of the chronic diseases that I spoke to. So we will be managing this and balancing health and wealth and interacting with those two things for quite some time to come.
Would add to
Dr.
that let's look at history a little bit. The world has had many pandemics before. This is not the first time that we are going through a pandemic. The 1918, million people dying of having something that could help them to fight, that they would have taken option. But they didn't have anything. They didn't have any vaccines against a virus that also was then changing and mutating. Mutating is what viruses do, right? That's what the flu virus does. It mutates, and so then every booster jab or a new vaccine for the flu virus that we expect for that year. And so that's how we've learned to live, as it were, influenza, right? And in those foreign northern countries where the flu is seasonal, right, they have drives, public health campaigns and drives to get the vulnerable people vaccinated for their flu shots when the time comes. This is far worse than the flu. COVID is not just a regular influenza virus. And so it is changing faster, it is mutating faster, and that's why the vaccines, so far, although they're keeping coverage, we have to look constantly at them to see what we need to do and if we need to tweak them or add booster doses and so on. So as Dr. Sober said, vaccination is the most powerful our weapons in our arsenal, but also keeping all those other things going as well. No one has a crystal ball. No one knows the future. We can say, we don't know when it will end, but eventually, from the history of the world, most severe pandemics did come to an end. And if you take smallpox as an example, it came to getting those vaccines to all the countries that needed it, right? Because initially smallpox was only vaccinating a small section of the society, and then all the countries of the world came together and took a decision to try to get smallpox vaccines to all the countries that needed it. And that's how smallpox was eradicated.
Dr. Greenidge?
Yeah, from the economic side, we do assume that this is a new norm as we project when the economy